Rotator cuff tear is an orthopedic disease condition. Look at this picture shows that shoulder joint tear of tendon. X-ray shoulder to rule out bone abnormalities. CT scan findings. Look at this. MRI, a detailed image of soft tissue damage. A detail going on. Introduction. The rotator cuff is a group of muscles and tendons that stabilize the shoulder joint and allow for a wide range of arm movements. A rotator cuff tear is a common injury, especially among athletes and older adults, that can significantly impact a person's mobility and quality of life. Early diagnosis and appropriate management are crucial to prevent long term complications and restore functionality. Etymology. The term rotator cuff originates from the Latin word rotor, to rotate, and the anatomical function of the cuff like arrangement of four shoulder muscles that stabilize and rotate the arm. Tear refers to the rupture or damage of these tendons, often caused by trauma, overuse, or degeneration. Definition. A rotator cuff tear is a partial or complete tear of the tendons in the shoulder that connect the rotator cuff muscles to the bone, often caused by injury, overuse, or degeneration. It can result in shoulder pain, weakness, and limited range of motion. Types. 1. Partial thickness tear. The tendon is damaged but not completely severed. 2. Full thickness tear. The tendon is completely torn, often leaving a hole in the tissue. 3. Acute tear occurs suddenly due to trauma or injury such as fall or lifting a heavy object. 4. Chronic tear develops gradually over time due to wear and tear, often linked to repetitive motions or degenerative conditions. Causes: 1. Trauma, a direct impact, falls or lifting heavy objects. 2. Repetitive use, overused activities such as painting, swimming, or playing tennis. 3. Degeneration, age related wear or tear of tendons. 4. Poor posture can strain in the shoulder muscles and tendons over time. 5. Shoulder impingement syndrome, repeated pinching of the rotator cuff tendons. Risk factors: 1. Age, higher risk individuals over 40 years old. 2. Occupations involves repetitive overhead movements. 3. Sports such as baseball, tennis, and swimming. 4. Smoking, impaired tendon healing. 5. Family history of rotator cuff injuries. 6. Poor physical conditioning or muscle imbalance. Complications: 1. Chronic pain and discomfort. 2. Limited range of motion. 3. Weakness in the affected arm. 4. Development of zone, shoulder. Adhesive capsulitis. 5. Arthritis in the shoulder joint. Pathophysiology: rotator cuff tears occur due to mechanical overload, degeneration, or trauma. The tendon's vascular supply diminishes with age, leading to reduced healing capacity. Overuse or repetitive motion causes micro tears that accumulate over time, weakening the tendon structure. In acute injuries, excessive force can cause a sudden rupture. In chronic conditions, tendon degeneration may lead to progressive tears, often involving inflammation and fibrosis. A rotator cuff tear involves damage to the group of four muscles and their tendons that stabilize the shoulder joint. These muscles, supraspinatus, infraspinatus, teres minor, and subscapularis, are responsible for shoulder movement and stability. Below is the step-by-step pathophysiology of a rotator cuff tear. 1. Initial damage or stress, acute trauma, chronic overuse. 2. Tendon degeneration, age-related changes, translate stress and shear forces. 3. Impingement syndrome, optimal factors, narrowing of. 4. Partial or complete tear, partial tear and complete tear. 5. Inflammatory response, pain due to activation of nociceptors. Edema from inflammatory mediators like prostaglandins. Loss of function due to pain, swelling and structural disruption. 6. Muscle atrophy and fatty infiltration. 7. Joint instability. The rotator cuff muscles provide a dynamic stability to the shoulder joint. Tears lead to imbalance, restless in abnormal movement patterns, reduced range of motion, and increased stress on other shoulder structures. Example, the cartilages. 8. Secondary shoulder issues. Chronic tears may result in shoulder stiffness or frozen shoulder. Adhesive capsulitis, glenohumeral arthritis due to altered biomechanics and wear on the joint surface. Signs and symptoms. 1. Pain in the shoulder, especially at high risk or when lying on the affected side. 2. Weakness in lifting or rotating the arm. 3. Limited range of motion. 4. Popping or cracking sounds during shoulder movement. 5. Swelling or tenderness around the shoulder. A diagnosis. A. Physical examination, assessment of shoulder strength, range of motion and pain. B. Image tests. 1. X-ray to rule out bone abnormalities. 2. MRI provides detailed images of soft tissue damage. 3. Ultrasound visualize tendons and detected tears. C. Special test, clinical maneuvers like the drop arm test and Hawkins Kennedy test. Nursing diagnosis. 1. Acute pain related to tissue injury. 2. Impaired physical mobility related to musculoskeletal impairment. 3. Risk for impaired skin integrity related to immobilization. 4. Knowledge deficit regarding condition and treatment. 5. Anxiety related to pain and functional limitations. Management. First, medical management. 1. Medications. Non-steroidal anti-inflammatory drugs for pain relief. Corticosteroid injections to reduce inflammation. 2. Physical therapy exercises to strengthen shoulder muscles and improve range of motion. 3. Surgical intervention if necessary. Arthroscopic repair, open repair for larger tears, tendon transfer or shoulder replacement in severe cases. Nursing management. 1. Educate the patient on proper use of sling or immobilizers. 2. Encourage adherence to prescribed physical therapy. 3. Monitor for signs of complications like infection or worsening pain. 4. Provide emotional support and reassurance. 5. Assist with pain management techniques. Treatment options. 1. Conservative treatment. Rest and activity modification. Ice and heat application. Physical therapy exercises. 2. Surgical treatment. Minimal invasive arthroscopic repair. Tendon transfer from irreparable tears. Reverse total shoulder arthroplasty for severe cases. Psychosocial medicine. 1. Counseling to address anxiety and fear related to limited mobility or surgery. 2. Support groups connecting with others facing similar challenges. 3. Patient education providing information about the condition and recovery process. 4. Stress management techniques encouraging relaxation exercises such as meditation or yoga. 5. Goal setting helping patients set realistic recovery milestones. Prevention. 1. Maintain proper posture during activities. 2. Strengthen shoulder and upper body muscles with regular exercises. 3. Avoid repetitive overhead motions or take frequent breaks during such activities. 4. Use proper techniques during sports or physical labor. 5. Address shoulder pain early to prevent worsening of the condition. In conclusion, a rotator cuff tear is a significant condition that can limit an individual's ability to perform daily activities and diminish quality of life. Early diagnosis, comprehensive treatment, and preventive strategies are crucial for effective management. A multidisciplinary approach involving medical professionals, physical therapists, and nurses ensures optimal recovery and minimizes long term complications. Thank you. Have a nice day.